Hey folks, this is Engineer 775. Wanted to share with you some really cool gear in the medical arena today. This is not my area of expertise, and there will be disclaimers in the beginning of this video and in the end and maybe in 100 places, so that you do not take anything that I say on this video as medical advice, because that is not my expertise. In our group we have licensed pharmacists, licensed nurses, and so we've got people that basically I'm going to be, maybe like you, the supplier of materials and equipment that you can give to them so that they can treat wounds, deal with dental concerns, any type of trauma. And so I'm not going to pretend to be a doctor today, even on YouTube, which I could pretend, and my wife said you better not. So I'm not going to do that, but I want to show you 3 separate kits today. So I've got everything set up on the table here. We're going to basically walk through, this is a gunshot kit, here's this awesome dental kit, and then there's the family stomp bag, which is a huge trauma bag. And so what we're going to do here, and my wife thankfully has written down some bullet points, and forgive me if I read them, because this is not a solar system, this is not pumping water, this is a gunshot wound kit. So what if somebody, and we've seen people do this on YouTube and Facebook, and we cannot believe they did it, but there are accidents where people have actually shot themselves at the range, or there's some sort of a stabbing injury. And I will share, I got a good friend in East Jerusalem that's dealing with tremendous trauma right now, and he has asked for help in terms of people donating to send them Celox and bandages that can stop bleeding, because there's a lot of trauma going on in Jerusalem right now. And so having kits like this is very important to a medic, to an EMT, having the gear. So let me talk to you about, just like a look at the gunshot wound kit, okay? Again, disclaimers on everything. I am not trained to be able to share this with you. This is a very lightweight kit, and it all comes in this MOLLE pouch. Everything is super heavy duty, and this again is all coming from Dr. Bones and Nurse Amy, who go through these kits and their videos in detail. So I'm going to leave the details and how each item is actually used, from the Celox. This is awesome. I will say one thing, there's a lot of people that talk about medical, but they don't have a medical background, and they do dangerous things. So like the Celox, this is an injectable applicator where you can actually get into a very small, like a bullet wound, and inject the Celox into there to stop the bleeding. Some people have talked about using tampons and things. That is the opposite from what you want to do. That's a very dangerous thing, from what I've been told by the medical professionals. So some amazing things. So you've got internal bleeding. Wouldn't you want to get to the actual site? And if you can, these kind of things get to the site as opposed to putting a bandage on top. Soft T tourniquets seem to be the way to go now. You've got everything from chest seals for if the wound is all the way through. You're sealing on the inlet and the exit wound. You have basic equipment to get at the wound and begin the wound care. You have your combat casualty cards so that you can identify where the patient has been injured. And again, for me, this would just be handing this off to somebody that is trained to do this. Yes, and I'm feeling convicted. I need training as well, but we have some folks that are way ahead of me. So, great kit. For the details and the prices and everything, I'm gonna point you to Doom and Bloom, their website, Dr. Bones and Nurse Amy. They're just awesome. I had the privilege of meeting them at a local campground for our annual prepper camp, and it was a great opportunity. So we're gonna go to the next kit. This is a dental kit. This is Nurse Amy's deluxe dental kit, and it allows you to do a lot of things. Replace lost fillings, fix bridges, fasten loose crowns, drain abscesses, extract teeth, you name it. It can do a lot of things. The kit comes with, where there is no dentist, this is kind of the standard. This can help you tremendously in figuring out what you should do, how to diagnose the problem, and then do everything from putting in and refilling and packing fillings. Just amazing. There are a lot of heavy duty. You will not in any of these kits today, you're not going to get this stuff at CVS, okay? From heavy duty elevators and extractors, you know, it just, you're not going to find this locally. So it's a real amazing kit. Again, the book explains how to do and use just about everything. You know, you never know just where you'll end up, and not having the tools to do what you need to do is very scary to me. So this is a $200 kit. All the information, the links will be in the description on how to find the kit. But imagine being able to do some basic dental work on a person to save just a lot of pain and suffering. We're going to come down to the next kit, which is an unbelievable kit. It has a lot of things that are in the other smaller kits, like the C-locks, all the hemorrhagic bandages. And so this is for a family or a group, you know, concerned about injuries. Maybe there's civil unrest and you're sheltering in place and you just can't get any place. This kit comes with everything: splints and wraps and suture kits and all sorts of stapling kit. You know, things you're not going to get this at CVS. A stapling kit. You're just not going to find these kinds of things. So you have enough dressings. This is a huge bag, and we pulled out a bunch of things, but it's still jam-packed full of this. And I will say, as this reminded me here, you know, this, we're not talking anything about antibiotics, but in terms of getting antibiotics and needing prescriptions for that, which you do, consider that in anything from gunshots to dental to major medical events. You want to make sure you've taken care of those things in a legal fashion. Lots of gauze. You can never have enough gauze. Impossible to have enough gauze. Just stuff that I can't even begin to talk about. I'm not even going to try to fake my way through here. But there's some cool gizmos, because I like gizmos. Pupil gauges, being able to, see, I don't even know how to use this thing, but it basically shows the size of the pupil, and you shine the light into their eyes and basically diagnose. It's just a great diagnostic tool there. And I don't know if we put the... Anyway, we'll move on from there. A soft T tourniquets, again, some redundancies. Just has everything from your stethoscopes, your blood pressure cuffs, eye wash stations. Covers just about all things. So I was going to do 3 different videos, but I am not the expert in any way. I'm going to point you to Dr. Bones and Nurse Amy. They are phenomenal. They are a great asset to the prepper community, and they just have a wealth of knowledge. So if you don't have anybody in your group, seriously consider getting trained, or just start recruiting people into your group that know how to use everything on here. So, and those people don't have to be doctors. They don't have to be doctors. You want a great nurse. We got an ER nurse, a pharmacist. If you can get an EMT, a medic, somebody like that, you're going to do, you know, you're going to be so much farther ahead. Because typically the nurses in the ER and the medics out in the field, they're the ones that know how to stop bleeding, know how to diagnose quickly what's going on with that person, and how to get them to a better place of medical care. So again, read the disclaimer. I am not in any way an expert in any of these things. I just joke about being able to do extractions and fix gunshot wounds. I myself need some training in these areas. I'm very thankful that in our group we have people that just live for this kind of thing. They understand what to do, they react fast, they're able to diagnose accurately. But if you don't have the equipment, it doesn't mean a thing. So my goal would be, if I don't know what to do, is at least supply those that have the expertise, the ability to save lives. This is Engineer 775 signing out.